being recorded. Lovely. So yes, thank you, Clive, for the introduction. I thought it'd be useful anyway to start just by introducing myself. We're going to be looking this evening at chronic stress, particularly the management or the mitigation of that by physical therapy and the impact of all of that on you. Sorry, it doesn't let me use my return. So yes, that's me. As Clive said, I'm Johnny Spadaccini. I am an osteopath, and I'm also a unit leader and lecturer and practice educator at University College of Osteopathy, which in old money was the British School of Osteopathy. I have worked in various practices across southwest London, so East Sheen, West Molesey, and until very recently, for the last 3 or 4 years, run my own practice in Bembridge on the Isle of Wight. But now I've relocated to London fully again. As Clive said, before that, I was an occupational therapist and I worked in the NHS. And I worked predominantly in hand therapy, so largely out of Guy's and St Thomas's. And I worked in plastics and trauma units, rehabilitating patients who'd sustained sort of fairly significant trauma and injury. So falling out of trees, holding chainsaws, that sort of thing. So, you know, despite that varied and broad background, I don't for one moment want to set myself up as an expert in stress or chronic stress. But it certainly is something and a kind of presentation that we see over and over and over again, really, in physical therapy departments. So I thought it'd be really useful to kind of explore that a little bit and explore the role of physical therapy within that. So in terms of what we're going to be looking at, if you'll indulge me, I think it would be really useful for all of us to just sort of centre and ground. So we're just going to start with a kind of de-stressing, for me more than anybody else, a de-stressing sort of mindfulness, quick meditation. And then I'll talk I mean, this is not a massive scientific talk, but I do need to introduce a few terms that are just going to help sort of understand really this concept of physiological stress. So I'll talk a little bit about this idea of homeostasis within physiology, which is probably a term that many of you are familiar with. We'll look at what the stress response is, and obviously, you know, sort of reinforce this idea that stress is normal, and we need a stress response. But what we're interested really is sort of when we overdo that, and the lives that we lead, many of us are in this kind of chronically stressed, hyper-aroused state, and potentially not in a good way, where, you know, parts of our nervous system are sort of constantly in overdrive. And what the physiological effects specifically on your health might be, and particularly in terms of your musculoskeletal health. So what is chronic stress doing to our bones and our joints and our muscles and our ligaments? And then we'll look, again, in very broad brush detail in terms of the physical therapy management of the chronically stressed patient. My background is osteopathy, so I've probably got a slightly more kind of osteopathic manual therapy approach to this, but the principles really are the same. And obviously I should say that obviously no two people are the same, no two stress responses or stress presentations are the same, but actually the kind of physiological sequelae probably are in all of us. So I think there are things that could be useful for us all to kind of appreciate. So it's obviously quite difficult because I can't see you and your questions are going in the chat. So, but if you'll indulge me, what I think we should do is actually just settle for a moment. So I want you really now just to sit comfortably in your chair in a posture that's comfortable for you. This is a whole other talk, but there's no such thing as bad posture. So I want you just to settle into a comfortable posture for you and feel soft and relaxed, but alert and dignified. And if you're comfortable, because obviously we can't see you, then gently close your eyes, but don't if that makes you uncomfortable. And I just like you to notice how your body feels. What physical sensations you're experiencing at this moment. You might feel the pressure. You might feel the contact of the chair that you're sitting in. What does that feel like? Just want you to be open and curious for a few moments and open to any other sensations that you might be aware of in your body. Take a moment too to listen to any sounds you can hear. What's their quality, their register, their volume? Notice how you're responding to them. You might notice an automatic tendency to try and identify the source of it. See if you can suspend that for a moment. Just notice the sounds as sounds and the silence between them. Notice your breath. What does it feel like? You holding it? Which parts of you are moving as you breathe? And how many different movements can you feel? What does it feel like to be in touch with your breathing? Let your awareness shift to your emotions. What's your broad tone of emotional experience? Are you now feeling content, calm, perhaps irritated, frustrated, or maybe not even sure of what you're feeling? Notice any thoughts passing through your mind. Ask yourself, what am I thinking? Let your attention just go to those thoughts for a few moments. Let them drift and disappear. And to finish, spend a few moments with the sensations of the breath in your body, letting those thoughts and those sounds and those feelings, and those emotions come and go. There's no need for a special experience. Simply notice what's happening. Notice moment by moment. And when you're ready, just gently open your eyes, refocus, wiggle your fingers, wiggle your toes, stretch and yawn, and check in. Where are you now? So do leave any comments in the chat, just anything that you noticed with that that may be, sort of drawing to your own kind of, sense of your state of being, or you may have nothing at all, or indeed you may be asleep. But they can be quite useful exercises and very, very straightforward and simple, really, just to do that kind of body scanning, really. And we'll come back to this at the end. So stress. Hopefully now we're all feeling a little less stressed and a bit de-stressed after that, brief meditative mindfulness example. But really, in order to understand stress, what we're talking about is a kind of body-based physiological response. I think we all sort of appreciate stress as a sort of psychological state, but really what we're talking about is the effects of that on our biology, what it's doing to our physiology. And central to that is this idea of homeostasis in health. And again, as I say, for many of you, this is a word that you're probably familiar with. Homeostasis meaning same stability, this idea of balance and equilibrium, if you like. And within this idea, there are sort of two essential concepts. One, that there kind of exists a single optimal point or level for any sort of measure of the body. And so we might understand this, that yes, a good blood pressure is sort of 120 over 70 or whatever. But actually, we're living organisms, aren't we? We get up, we move around, we do stressful things like, I don't know, doing a talk to 60 inquiring minds, perhaps on a Monday evening. And we need our blood pressure to go up and down as a consequence of that. I need my blood pressure to be different when I'm asleep from if I was abseiling down the front of a building, for example. So we know that that single level optimal point has to shift a little bit, but that we can reach that point, and this is the second overall point about homeostasis, we can reach that point through some sort of regulatory local feedback mechanism. And, if something happens, it stimulates something, a nerve is, communicated, or, a gland is stimulated to secrete a hormone or whatever. And it kind of resets that point through all of that feedback mechanism. And within us, there are many, many regulatory mechanisms controlling, if I go back to blood pressure, that in the short and long term. So it's sort of quite a sort of more realistic understanding of homeostasis would be something called allostasis, which is about variable stability. And it's really about the stability of an organism or a physiological system to maintain life within that narrow range for its current state, knowing that that current state is going to change. And that's important from a kind of stress response perspective, because a stress really, or a stressor, is anything that's going to throw our body, that's going to throw our physiological state out of homeostasis, out of that balance. And our response to that physiological response, is a way of restoring that balance, either by secreting hormones or by stopping their secretion, or through the kind of acceleration or deceleration of nervous system activity. The important thing to remember with all this is that we don't actually get stressed by a stressful situation. Instead, we kind of activate that stress response, that cascade of physiological responses, in anticipation of that situation. And that could be a psychological, a sociological, an emotional trigger, or whatever. But the really important thing is, despite kind of 300,000 years of the human genome, we turn on the same stress response regardless of the stressor. So we're absolutely turning the same stress response on if I really was to be attacked by, a sort of loose lion on Putney High Street. Or it's exactly the same stress response if I'm stuck in a traffic jam, or if I'm going to a job interview, or if I'm, giving a talk. So why on earth would we do that? And this is the kind of key, really, to sort of understanding chronic stress and this kind of hyper-aroused state. So next slide comes with a bit of a trigger warning. And if you're anything like me, that's particularly triggering. I won't linger on this slide for those of us who do find this really distressing, but I am profoundly arachnophobic. And the older I get, the worse it seems to be becoming as well. And I know there's things I can do, like the friendly spider program at London Zoo, but the thought of it absolutely horrifies me. And I do know that, of course, spiders are out to kill us all the time. Otherwise, why would they have such obscene bodies and 8 legs? Nothing needs 8 legs. So I have initiated a stress response because of this image. And obviously my life isn't endangered by looking at this. I'm perfectly safe as a consequence, but nevertheless, I've triggered that physiological stress response. There are widespread physiological changes now coursing through me. My heart's probably beating a bit faster. I'm pushing more blood to the muscles in the heart, so I can basically fight or flight. I can, take on that tarantula, or I can run away from it. My pulse rate's going to go up, my blood pressure's gone up, my breathing rate has increased. And all of that basically is to essentially get oxygen to those tissues that need it to meet that threat, to meet that demand. So that's to my muscles, my lungs, my brain, my special senses, and so on. So my lungs, my bronchioles are opening. I'm taking in as much oxygen as possible. That's sending more oxygen to the brain. That's increasing my alertness. My senses become sharper. Meanwhile, stress hormones, and we'll look at a few of those. So noradrenaline, that's released glucose and fats from storage sites around my body. Because essentially I need energy. I need to get my body needs to get its hands on, so to speak, as much energy as possible so that I can meet that demand. I can literally fight or flight. And so those nutrients are flooding into my bloodstream, supplying energy to all parts of my body that need it immediately. And let's face it, I don't need any of that immediately, do I? But nevertheless, that's what's happening. And it's happening if we've had a really rubbish day and it's Monday and it's cold and it's wet and we've got home and this is in the sink, or we were late for a meeting and we're stuck in traffic, or your teenager still hasn't cleaned their bedroom despite the 17,000th time of asking, or you've got a job interview, or you're just dealing with loads of stuff. It's the same stress response that we're turning on over and over again. All of those physiological changes that I've just mentioned are occurring if we're sort of triggered by this sort of thing, and we all are. So why would that happen? Why would we do that? And it's about staying alive. It's about releasing the energy we need to meet the demands. But in our very kind of comfortable, affluent Western civilization lifestyles, there are very, very few demands that we need to be meeting at that level all at the same time. We need to be delivering that energy, that sugar, that glucose basically to our muscles. We need to be increasing our heart rate. We need to be increasing our blood pressure. We can see, looking at this, where the problems might be if we're doing that long term. Because in order to do that, we need to shut down those projects that we don't need at the moment. I don't need to be able to reproduce, and I don't need to be able to digest if I really am dealing with a kind of fight or flight response. So those projects get shut down, and to a certain extent, then so does our immunity. So we can see then that it's kind of diminishing returns. We're not storing any energy. We're using all the energy that we can basically get our hands on. We're getting increasingly fatigued. We've become at increased risk of illnesses and diseases like diabetes. There's no rest or repair. We've got poor tissue health, poor tissue recovery, and then we're increasing our susceptibility to illness and disease because we're shutting down those longer term projects like our immunity. So obviously, I won't go into a lot of detail, but it's really to look at kind of the impact then of these stress hormones on our physiology. And there are two types. We'll look at adrenaline and noradrenaline and the glucocorticoids, particular cortisol, which again, we're probably all familiar with. So we're boosting that supply of oxygen. We're boosting that supply of oxygen and sugar to those essential organs that need to deal with that stress, that thing that's thrown our system out of its allostatic balance. So it's going to our brain, it's going to our muscles, it's going to our heart and our lungs. Our blood pressure's going up, our heart rate is going up. And actually at this stage, we've got selective blood vessel changes as well, because we need to be able to shunt the blood into the tissues that need it. The thing about the cardiovascular system is that tissues need to create the demand. You can't force blood into a tissue that isn't creating the demand. So all of those tissues are creating increased demand for increased blood and diverting it from other areas. Our pupils are going to dilate. We can take in much more light. We can be much more aware of our surroundings. But we're shutting down those longer term projects. particularly our immunity. So we've got increased susceptibility, therefore, to, illness and disease. Stress doesn't make you ill, but it makes you more prone to the diseases and illnesses that will make you ill. Our cortisol, our glucocorticoids, that's circulating now through our bloodstream. And actually what that's telling the liver to do is to convert protein, to convert amino acids into sugar. So we've got rapid energy available. And really, we want those proteins, the building blocks of life. We don't really need to be using them for kind of energy. So we get increasing sugar circulating, in our circulation, and we all know the consequences of that in terms of risks of, insulin dysregulation and diabetes. We're not making new proteins because there's no need to do that, because we're converting the proteins that we've got into sugars, and we're breaking down lipids in our fat cells as well, to give us fats and to give us sugars ready available for energy. But if we're doing this all of the time, and we're doing this in the context of where there isn't actually a particular threat, then we're at risk of various effects, aren't we? So the likelihood is that we're going to then start to experience hormonal imbalances. And those hormonal imbalances are going to lead to an increased physiological stress response, which will lead to more hormonal imbalance, and so on, ad infinitum. If we're shutting down those longer term projects, then we're definitely experiencing digestive disruption. So symptoms that we might associate with things like irritable bowel syndrome, constipation, diarrhea, bloating, all of those things. Decreased immunity I've talked about, and our blood sugar regulation goes haywire. So we've got this kind of dysregulation of insulin and propensity then for kind of diabetes. As I mentioned, we don't need to be worried about fertility or reproduction. So those processes slow down. And specifically, which we'll look at in a moment, we get very specific changes to our muscle tissue and to our collagen structures and ligaments, which will have sort of profound effects on our own musculoskeletal health. And given the relationship between our musculoskeletal health and all our other systemic health, then it becomes sort of self-perpetuating. We certainly might experience some degree of cardiovascular system disruption, like high blood pressure, high cholesterol, and so on. And we are likely to feel different. We are likely to feel hypervigilant. Our threshold for stimulation is likely to lower. We're probably going to experience, increased sleep disturbance, mood changes, irritability, possibly anxiety and depression. And I think, all of us at any point can probably recognize some of these signs and symptoms that we might be able to put down to stress. So what does that look like? How do we sort of recognize that in ourselves, but also in a kind of clinical setting? There's certainly exhaustion. There's certainly a kind of changed sleeping pattern. Sleep is no longer as restorative as it should be. There's probably disrupted sleep and poor sleep patterns, and we might notice an increased reliance on sugary foods, cigarettes, alcohol, and so on. We might experience, as I say, varying symptoms of IBS, so varying between constipation and diarrhea and bloating and pain and all sorts of things that we might make nutrition very, very difficult for us, and particularly that we're interested in very widespread muscle aches and pains. And I think in the context of chronic stress and chronic kind of hyper arousal of that particular part of our nervous system, it's very widespread, it's very non-specific, it's also very kind of at times non-mechanical. It's very hard to pin down in terms of aggravating and relieving features. Given that we're shutting down those longer term projects like fertility and reproduction, it's likely that there'll be associated disruption to menstrual cycles and even menopause. Cognitively, we might notice difficulty decision making, problems with memory, sort of brain fog type things. And as I mentioned, this kind of hypervigilant state. And I think, as I say, we probably can all recognize some or all of this at some or other points of our lives. But one thing I did kind of want to make a point of is the very, very specific effects of these stress hormones on our musculoskeletal system. So on our bones, on our joints, on muscles, and our ligaments. And basically, adrenaline and noradrenaline, those stress hormones, essentially, as I say, they're trying to get the energy to where it's needed. And they're trying to make sure that as much energy is released as possible so that we can keep meeting the demand. So in order to do that, essentially what it's doing is raising our circulating protein. So instead of having protein in the tissues that need them, it's all being broken down and it's now in our bloodstream. So we've got reduced collagen formation. And obviously collagen is essential for healthy joints, healthy ligaments, healthy bones, all connective tissue, basically. So if we're not making collagen, if we're not creating it, then we've got to change the absolute structure of our tissues. We're no longer taking proteins or amino acids, so the building blocks of protein, into our muscles. And actually what we're doing is taking amino acids and protein out of our muscles so that we can use it and convert it into sugars. And obviously we don't want to do that because, protein is essential for muscle tissue health. We're not making any more new proteins. We've shut down that process, or adrenaline and noradrenaline have. And we've started to break down the available proteins so that they can be converted by this process of gluconeogenesis, if you want a fancy word, into sugars. So we've got increased sugar available for the energy that we need. So that presents, we're going to have decreased muscle mass. Our collagen structures, particularly our ligaments, are going to become weaker. So they're going to do a less effective job of stabilizing and looking after our joints. And that means our muscles and our tendons will have to take over a little bit more responsibility for that, as well as moving our joints. And so, they fatigue much more quickly, and they're going to fatigue much more quickly anyway, because the protein that we need to make them, what they are, is diminishing. We've got reduced bone formation, reduced bone turnover. So our chances of developing conditions such as osteoporosis, for example, with chronic stress, become much greater. Again, this reduced immunity, we've shut down these longer term projects. So our capacity to repair and restore and heal is profoundly compromised. Interestingly, with kind of chronic stress and chronic stress responses, we've also got this very kind of low grade inflammation in our tissues as well that goes on. And generally, broadly speaking, wherever we've got inflammation, we've got congestion, we've got degradation, and we've got symptoms. And so overall, we're in this position of kind of very poor, slow healing responses. And that manifests as things hurting, as our muscles hurting, as our joints hurting, as our capacity to kind of move and stretch and do the things that we want and need to do becomes so much more compromised. So it's all a bit doom and gloom, isn't it? Because essentially, this is about making protein available for energy. And, once we've used up all our usual energy sources, then we convert other things to provide that energy. So this is the equivalent, essentially, of burning your best or antique furniture to generate heat. There are just much more efficient ways of doing it. So what can we do about it? So again, as I say, this isn't a kind of one size fits all by any means. Excuse me a moment. And in a sense, it's different for everybody. Nor is this exhaustive as well. So I'm giving you sort of my take on it. If there are other healthcare professionals and therapists and osteopaths, then we're all going to have very different ideas about it and very different approaches to it. But I think fundamentally it all sort of talks to the same thing. Certainly, from a physical therapy perspective, I think a starting point with this is always breathing. It's always looking at those breathing mechanics and how those breathing mechanics have altered through this kind of sequelae of being in a kind of chronically stressed state. So if you remember, I talked about needing to get oxygen to those tissues that are creating an increased demand for it. We're going to recruit all sorts of other muscles and things and joints and structures to kind of increase our thoracic compliance and increase our thoracic and rib capacity. So we're going to start recruiting muscles, what we call our accessory muscles of breathing, to do a job of moving our upper ribs rather than really being, abdominal diaphragmatic breathers. So over time, and remember, these muscles are already struggling because of all the kind of sequelae physiological things that are happening as a consequence of the changes of that protein metabolism. So they're getting tighter, they're getting shorter, they're getting more painful, they're getting overused, they're getting, just not in, they're getting fibrotic, they're getting thickened. It's just not comfortable. So if your osteopath and your physio is working with breathing with you, then there are very, very good reasons why we might be wanting to do that from a kind of stress management perspective, about easing the load on those structures that aren't really designed to cope with the demand, and starting to recruit much more of a kind of lower rib abdominal breathing pattern. And there are all sorts of methods and approaches that we can do with this in terms of manual approaches and breathing retraining as well. But I would say that rib work and thoracic work is absolutely, a fundamental part of mitigating this chronic stress response. Because what I should say is, obviously, we can't take it away. I can't take your stress away, and I can't make you respond to your stress differently either. What I haven't included is any kind of psychological or cognitive approach, because that's sort of way beyond my remit. But of course, all of those things are going to help you address differently your reaction to that stress. So cognitive reframing, cognitive behavioral therapies, those sorts of things. But this is a very kind of physical therapy approach. I mean, for those of you, one thing I would say, if you are kind of the sort of person who would, mitigate for this with the, exotic foreign holiday, then absolutely that's the way forward. One thing I usually advise with that, though, is that you take your osteopath with you. As a kind of manual therapist osteopath, I particularly want to be interested in what your upper back and your thoracic spine were doing. So that idea of homeostasis that I talked about at the start is largely controlled by the actions of what we call our autonomic nervous system. So the part of our nervous system that we have no control over. And that's divided into our fight and flight bit, so our sympathetic branch, and then the other bit, the parasympathetic nervous system, that's our rest and digest, tend and befriend. So that sympathetic bit is in overdrive. We want to be kind of dampening that down and kind of really enabling that parasympathetic to sort of become not necessarily more effective because it hasn't stopped working, but we sort of want to kind of promote that. And these two branches sort of work in concert. We, as physical therapists and as manual therapists, understand, if you like, the relationship between that autonomic nervous system and the bits of you that we can get our hands on. So we know the bits of the spine that autonomic nervous system is going to enter and exit the spinal cord, and those are bits that we can work with. So very much a kind of manual therapy approach in terms of really enabling that thoracic spine to move better, those ribs to move better, manual techniques to kind of really ease tension in the neck and that area, just where your neck meets your head, because that's where a big branch of your parasympathetic nervous system leaves your skull to travel all the way through your body. So we want to kind of free off that vagus nerve. We can't physically do that. We can't physically put our hands on your vagus nerve. But in principle, we can create the conditions so that that vagus nerve, it has better mobility, has better nutrition, has better fluid health. So, a multitude of sort of manual techniques that we might apply directly to kind of mitigate that sort of sympathetic arousal and sort of improve that kind of parasympathetic tone. Certainly, we might work with you around ideas of, breathing again, but mindfulness and meditation. And if that's a particular sort of expertise or interest, then they can be really valuable tools to help control and kind of mitigate for those physiological effects of chronic stress. And again, there are endless techniques. Exercise is absolutely fundamental for the management of chronic stress in terms of the physiological responses to that chronic stress. And what I haven't included in any of this is a kind of references or resources or evidence base. It's out there and I have references if people are interested. But exercise is absolutely fundamental to mitigating for the effects of this kind of chronic stress response. That said, if you don't like exercise or if you don't like certain types of exercise, then it isn't necessarily going to be that helpful. It really is about finding the right exercise for you that you enjoy doing and that you can sustain and that you can commit to as well. There is some evidence to suggest that actually group exercise works better from a kind of chronic arousal, chronic stress management approach. But group exercise isn't for everybody, and many people just prefer to exercise alone. I think the key to all of this is actually finding something that you enjoy doing and doing it in ways that you can sort of, physically and emotionally commit to. Yoga is another really good example of physical therapy techniques and exercises and programs that, can be introduced to manage and mitigate for the effects of this kind of chronic stress response. I'm not a yoga expert. I know there are probably many out there, but even from the perspective of breathing, abdominal breathing, focus, mindfulness, meditation, all of those things that are going to stimulate that parasympathetic response, then yoga is an absolutely brilliant option. Also, we need to be mindful of the fact that in sort of super chronic stress situations and the changes to our ligaments and to our joints, that we're not overdoing it, that we're not overstretching, that we're not overstraining. So certainly supervised one-to-one yoga is, if you're new to it, is definitely beneficial, because obviously you don't want to be causing more damage to those things that are already being compromised. One thing I think increasingly that we can help with as well is this broad idea of sleep hygiene. So if you think about the need to kind of restore and repair our tissues, then our sleep is definitely the time that we're going to be doing that. So certainly just in terms of the ergonomics of sleep, your setup for sleep, your pillow, your position, all of those things physical therapists are going to be able to help you with in ways that are going to facilitate better breathing, better relaxation, better positioning of joints and so on, alongside all the other stuff, the general sleep hygiene stuff of, screen avoidance and, no caffeine and all of those sorts of things. So there are, again, multitude of ways that we might work with you in terms of kind of sleep hygiene. Some therapists, physical therapists, osteopaths, physios may be nutrition experts. I'm not. So I'd certainly be referring you on to a nutrition expert. If we think about the impact of chronic stress on your digestive system, then we know that a lot of it is kind of, in a sense, shut down. It's altered. Blood and nervous activity is being shunted away from that to something else that is demanding it more. So certainly working with a nutritionist or a dietitian in terms of establishing a sort of healthy, broad diet that's going to promote absorption, is going to minimize kind of inflammation, would be really, part of that overall package as well. That's not endless. Those are kind of broad ideas, and if you were my patient, if you are a patient, you came to see me and this was one of the issues, all of these things would incorporate really into terms of managing and mitigating for that stress response. But, it's limitless in a sense. So I realize that was a bit of a whistle-stop tour. What I'm going to do is just sort of get us all a bit centered and grounded again. So we're going to check out now, again, with a just slightly quicker mindfulness body scan meditation. So again, what I'd like you to do is just settle into your comfortable posture, soft and relaxed. Let your eyes gently close. I've been talking about bodies a lot. What I want you to do is just imagine that you're casting a beam or a spotlight over your body. And as you do that, what comes to your attention? You might notice the urge to react. You might even notice the urge to move. What thoughts or feelings flood your awareness as soon as that part of you comes into focus? Just notice that. Acknowledge those responses and then release them. Just let them float away. And then just be curious to the whole of your experience, the parts that are drawing your attention, because they might not be settled. And then the parts that actually feel surprisingly good, and try to let that float by. And when you're ready, just open your eyes, wiggle your fingers and toes, yawn and stretch, and that's the end of the presentation, so you can stop recording and I'll stop sharing the screen. Thank you all very much.
Jonathan,